Hi, I'm Dr. Mountain. This is a needle. Now, these are acupuncture needles. And they start from so small that they are almost like a tack. If I open this up, this is so tiny, you probably won't even be able to see the needle on camera. A lot of people will put it right here in their hand. There's places on your forehead or anywhere you can put that. These are very small plastic handled needles. These are very smooth gliding. I think these are made in Japan. Plastic handled needles. These needles have a wound up handle on them, and there's sometimes cases that we will use even longer needles, and there's some instances where we would use even longer ones yet. Acupuncture is an interesting tool that I use frequently in my practice. Now, a lot of people will be familiar with the traditional use of acupuncture, which it follows the concept of meridians. Each of them will have a name, and they'll have a beginning and an end point. They might start in the fingers, and they might start in the feet. Then they'll follow these channels: stomach, large intestine, the lung channel, the heart channel, and they go all the way around the body. And Chinese medicine has been doing this for thousands of years, and it's an interesting concept of acupuncture. In my practice, I tend to use a more westernized approach to acupuncture, and I would put needles in points that are in muscles that are sore, or the muscle might be contracting when it shouldn't be. It might correspond to a traditional acupuncture point. A common place would be up here in the shoulder, in the mid-trapezius. That's gallbladder 21. I would commonly do the extensor muscles of the elbow for tennis elbow, lateral epicondylitis. Now, that does correspond to the channel of the large intestine, but I may not use that exact point location. If there's a more Western application for that spot, if there's a spot that's just more sore and it's just outside, as long as it's anatomically safe, I can put the point there. I'll do points up in around the rotator cuff, and they don't always correspond to a meridian or a channel. Now, other health professionals are utilizing acupuncture in this way as well. Chiropractors and many physiotherapists are using acupuncture now too, and many chiropractors. Adjustments are fantastic at moving the bones, but acupuncture can be a very good muscular treatment and be that missing link for some patients who are not getting better just solely with adjustments alone. This is another tool I will use. This is a stainless steel instrument, or a gua sha tool. I would use it to treat the fascia over the muscle, but the acupuncture needle is often better to go into the muscle to treat the muscle itself. So there are extensive studies on acupuncture, but acupuncture never meets the rigors of the gold standard for studies, which is a random double-blind placebo trial. You just can't fake putting a needle in somebody, and that's why, unfortunately, people come to the conclusion that there's no proof that acupuncture works. Well, it would be very hard to get proof for it, because you just can't have that double-blind control group. You can't have a group who doesn't know they're getting acupuncture, because it's really hard to do sham or fake acupuncture. Unfortunately, that puts us in a hard spot there, but I really do find that acupuncture works quite well in a lot of situations. It is by no means a cure-all. That's what I love about my profession. I have so many different things to utilize as therapeutic tools. So if you've never thought of acupuncture before, it's something that most naturopathic doctors do, especially if they're trained in the Canadian schools. It's something to think about, and it shouldn't always be more pain, more gain. I usually tell my patients that sometimes it does hurt, but in some people, they actually don't feel that it really hurts at all. So if you're afraid of needles, acupuncture needles are not hollow, like the first needle I showed you there. The acupuncture needles don't take blood away from you. It's it's feels a little bit different than getting a needle in the arm or having a needle take some blood or something like that away from you. It feels actually quite a bit different than that. And it doesn't have to be painful. It shouldn't be more pain, more gain. A note to keep in mind here in Alberta, in Canada, if you see a naturopathic doctor to get acupuncture, most insurance companies require us to bill as a naturopathic doctor. And if you had separate insurance for acupuncture, you may not be able to utilize that when you're seeing a naturopathic doctor. You may need to see an acupuncturist to use that. So just a note to keep in mind. So please check out some of my other videos if you have time. Making videos is a way to bond with my cameraman, my son, and he helps me on my YouTube content, but my priority is always to my practice here in Airdrie, and this is sort of a hobby, fun thing to do, but it really does line up with the doctor as teacher in my oath as a naturopathic doctor. I just love to teach people and expose people to new ways of thinking about things. So I really like to make these videos, so please like and subscribe.